this coronavirus situation which has been spreading across the globe. And as a country, we reported our case on the 13th of this month. And we have heightened our efforts to ensure that the situation does not spread beyond what we have. But as of today, we still have 3 cases of confirmed coronavirus patients. But in totality, those that are admitted are 20. Out of the 20, like I did indicate, 3 are confirmed, other 3 are suspected, and we have another 14 that are under quarantine awaiting results. So the second set of 3 that are suspected are also awaiting results. The other 14 are also awaiting results. Yesterday we did indicate a figure of 22, but according to medical protocol, we cannot keep anyone in hospital who has not shown any, the test results are not positive. So we keep on testing them, and those who have shown that they don't have the virus, then we let them go. But the first 3 that we are isolating beyond those that are positive cases is because the 3 met the case criteria. And the case criteria, like we have also indicated regularly, is that there is a threshold that you must meet in order for you to be isolated. Now, we did talk about dry cough, we talk about difficulty in breathing, we talk about fever, we talk about malaise. So those 3 met the case criteria, and that is the reason for which they're isolated, waiting for the test results. As a country and as a people, we have continued to strengthen our measures, and we have put effort in place to ensure that the situation does not escalate beyond what it is today. And the National Emergency Response Committee is coordinating together with other counties and other stakeholders to ensure that we do not leave anything to chance. And therefore, we have consistently continued to enhance our capacity at various levels. The first level that we're concerned about seriously is that if at all this situation were to sprout seriously at the community level, and we're not ready there, then we'll have a big issue. And therefore, we have consistently worked to enhance county capacity. And currently, we can proudly say that we have 35 counties that have confirmed that they have necessary quarantine and isolation facility to be able to deal or handle COVID-19 cases. They have testing kits, and necessary supplies have also been available to them in order to be able to carry out the necessary management of if cases would come up within the counties. These additional facilities within the counties are to ensure the county is able to handle the COVID-19 related cases in the event the county reports more cases, like I did mention, at the community level. We are currently undertaking training of trainers, and this is being conducted in all the 47 counties. This is aimed at ensuring that all counties have capacity to test and manage the disease. We are also conducting training of all health care workers at all health facilities, including, of course, Mbagathi District Hospital. Indeed, you recall that these are our first line of defense, and therefore we must be able not only to train them, but also to equip them well so that we can give them the confidence to be able to handle these cases as they come.